I'm Todd Neal, MedPage Today, reporting from the American College of Cardiology meeting in Orlando. Studies have shown that cardiovascular events spike among European soccer fans during important matches, but whether the same phenomenon happened in Americans was unknown. I spoke with Dr. Robert Kloner of the Heart Institute of Good Samaritan Hospital in Los Angeles about a study he and his colleagues did to find out.
We've been very interested in what are the triggers of acute cardiac events. I think everyone knows that they're chronic risk factors like high blood pressure, diabetes, high cholesterol. But we've been interested in the acute triggers that bring on cardiac events. For example, some include the wake-up time, heavy eating, physical, emotional stress. We did a study many years ago looking at the effects of the Northridge earthquake showing an increase in cardiac events in Los Angeles. Now, there have been some reports about an increase in cardiac events associated with intense soccer games in Europe. So we got interested in this question in sporting events in the United States. And living in Los Angeles, we were especially interested in looking at the LA County population and how they responded to sporting events. We looked at 3 time periods. We looked at the Super Bowl of January 20th, 1980, in which Los Angeles Rams lost to the Pittsburgh Steelers. It was a very intense game. We also looked at January 22nd, 1984, in which the LA Raiders beat the Washington Redskins, and which was not as close or intense a game. And then we looked more recently, the years 2000 to 2004, when Los Angeles did not have a professional football team. So what we found was a significant increase in the weeks around the 1980 loss of the Los Angeles Rams. There was an increase in total deaths, an increase in circulatory deaths, an increase in deaths due to coronary artery disease, an increase in deaths related to myocardial infarction. Of note, when we looked at the same data in 1984, we actually saw a decrease in total death rate in LA County associated with Los Angeles Raiders winning the Super Bowl. There was also a trend towards a reduction in cardiac death associated with that Super Bowl. And the more recent 2000 to 2004 study, in which Los Angeles did not have a professional team, there was no increase in cardiac deaths, no increase in total deaths. There was actually a very slight, very small % decrease in total death associated with the weeks around the Super Bowl.
He acknowledged that treatment for cardiovascular disease has changed since the 1980s, but said the results still apply today.
Now, the only time LA was ever in the Super Bowl was 1980 and 1984, and the treatment of heart attacks, the treatment for heart disease has changed quite a bit since then. But the recent reports of soccer games from Europe, which have all been within the last 10 years or so, showing increases in cardiac events associated with intense games, suggest that there still could be a risk of cardiac events for the very excited fan.
He said football fans should look after their cardiovascular health the same way anyone else would.
First, I think that any fans that have cardiac risk factors should treat those risk factors. So if you have high blood pressure, you want your blood pressure under control. If you have high cholesterol, you want that under control, and that sometimes involves, besides diet and lifestyle modifications, the use of certain medicines like statins. Diabetes should be under control, and of course we'd like people not to smoke. Now, if the fan is very, very excitable and knows that they're excitable, it might be worth them speaking to their healthcare provider about this, because there are some additional things that could be done. Relaxation exercises, deep breathing, drugs like beta blockers, aspirin might play some role, and even anti-anxiety agents might play some role. Now, no drugs are currently FDA approved for triggers of cardiovascular events. But again, I think this is something that the patient may want to discuss with their healthcare provider.
Reporting from Orlando, I'm Todd Neal, MedPage Today.